As Makar Sankranti heralds the sun's journey towards light and renewal, today we gather to begin a purposeful transition towards awareness and care. Good afternoon, everyone. It is an honor to welcome an ophthalmologist from across India who have come together digitally to pledge for the Dry Eye Disease Awareness Drive. Before we begin this momentous event, I would like to invite Dr. Ganesh to introduce our chief guest for today, who is Mr. Professor J.S. Titiyal. Over to you.
Thank you so much, Navneet. It's a privilege for me to be part of this mega event where more than 4,100 ophthalmologists, they came together for a cause, and in this single digital platform to make a pledge under the broader theme of best care, best eye care. Through this initiative, ophthalmologists have committed to raising awareness about a very prevalent condition, which is the dry eye disease, particularly that caused because of the excessive screen time, and it's encouraging individuals to adopt healthier eye care practices. On this very august occasion, it gives me immense pleasure to have our chief guest of today, Professor J.S. Titiyal sir. Who doesn't know him? He is well-known figure nationally, and he's currently heading the Regional Head and Clinical Services, Dr. Agarwal's Eye Health Institute, Delhi. Sir is a Padma Shri awardee, and he's president-elect of AIOS. He's also former chief of Dr. R.P. Center and Dean Research for AIMS, New Delhi. Can we just close our hands and welcome him on this floor? Yeah, he has a slide to also play through. Before that, may I request Sheetal sir to welcome Titiyal sir. Yeah. So just before the program, sir was saying, what can I say to this crowd? So we said, sir, whatever you say, it will be a golden words for us. The stage is yours, sir. Please enlighten us. Thank you.
माइक चलता है क्या?
हाँ
जी सर.
It's all on.
ओके.
सर एक वीडियो चलाना था जस्ट आपको जो मैंने डॉक्यूमेंट्री बनाई थी डिस्ट्रिक्ट ट्रेलर चलाना चाहता
हाँ तो इसी में डाल दो.
हाँ
वहाँ से चलेगा. अच्छा ओके ओके. यहाँ से कनेक्ट हो जाएगा.
एक मिनट लिए निकाल लेते हैं.
अच्छा
फिर कर लेंगे.
People say you're lucky. Luck may be there, but it has to be a little bit of your hard work and the wishes from your friends and your well-wishers that you get in that position.
पढ़ाई में भी अच्छे हैं, हर चीज में अच्छे हैं और किस्मत में भी अच्छे हैं.
I used to idolize my father and also I always wanted to be a doctor.
He's a surgeon par excellence and he is a man with a golden heart.
70-80 सर्जरी एक टाइम में एक टेबल पे बैठे बैठे कैसे कर सकता कोई आदमी?
क्योंकि उनकी छाया पर हमेशा छाया बन के रहा मैं, तो उससे मुझे लगता है कि आप शायद उनकी वजह से देखा यहाँ पे पहुँचा.
आधा पेशेंट तो इनसे मिलके वैसे ही.
Status, WhatsApp status also says live and let live, and he truly follows that.
Keep working, the reward will follow you. Even that amount of time and manpower is not sufficient to repay back to your student, your country.
भगवान हर जगह तो पहुंच नहीं सकते,
तो उन्होंने कुछ अपने नुमाइंदे बनाए होते हैं जो उनको रिप्रेजेंट करते हैं सोसाइटी में आके. He's one of them.
कनेक्टेड ले आना भैया. Silent.
Recording, sir.
It's recording.
It's going live.
Live, no? Okay. Okay. Thank you so much. Namaskar to all of you, and especially this very auspicious day of our country, Makar Sankranti. Wish you all the good things in your life on this particular day, and be happy, make other people happy. I think that's the motto behind any service we give or any service provider. It is not for them, it is for a society. And that is what I think mankind is also working on, to build a society. I'm very lucky that I'm standing in front of you, where people are looking for some sort of mass awareness for anything. It may be your health, it may be your how to manage certain things in your life. It requires the education awareness. Nothing education has improved across the country. But what about the health sector? I thought I will speak on what should be the vision for our country, for us, for 2047, because that's going to be 100 years of independence. As Prime Minister talks about Viksit Bharat, and I always say, yes, India may become a developed country, but one thing which is very important in that path is to have a good health, and accessible health for everybody who are living in this country. So what are those challenges we are going to face? That is what I want to highlight today in this few presentation. If you have any queries, because you people are working in one sector where you are going to provide the various facilities, the drugs, research which you are doing, which is going to take us to that world which is called Viksit Bharat. So that is what I thought I'll look after in next 10 minutes or so. Before I start, let me introduce myself. I am from a state called Uttarakhand. Some of you may be from Uttarakhand. How many of them from Uttarakhand? So, okay, at least 6 people are there. That makes around 5%. So Uttarakhand population is less than 5% in the country. But we are the most prominent people in this country. You name armed forces, Uttarakhand has always been number 1. It may be Gadwal Rifles, it may be a Kumar Regiment. They have fought all the wars in this country, right from 1965 onwards. And people are known as they are the best people living in this earth, because they come from a place called Devbhumi. So all the access towards the god and goddesses goes to Uttarakhand. So people have to be very, very good, and that is what I am. So my initial journey started from Uttarakhand only, and I've been lucky to be in an institution like AIIMS New Delhi, where I lived for almost 46 years. I just come out from that campus, but still my heartbeat, my blood has all those hemoglobin which carries the oxygen to survive, and that is what I am going to reflect and talk about. How should we proceed for this problem? So what is this Vision 2047 regarding the health sector? What is that vision 2047, and what are the challenges you're going to face in this coming 22 years? We should look into that. What should be our roadmap? What should be our goal to achieve this health for all? So that is what I'll briefly go through this. So if you look into this developed country or 2047, the goals are very, very clear. We're going to have a robust healthcare system which will provide the highest consistent standard for healthcare for all of us. That means you don't have to search where you have to go, what treatment you're going to get, what type of medicine you're going to get. It has to be all placed in the right way so that everybody gets advantage of good health, good care. So that requires a very strong infrastructure. So that's the challenge country faces, to build an infrastructure which is going to support this thinking of 2047. And education I talked about, education has to be there, a quality education. But most important for India to develop is the industries. We need to have an industry which supports our country's demand so that make in India things comes up. It's very easy to say make in India, but to produce the quality which we require is the important thing. The industry has a huge responsibility for taking country towards 2047 developed India. Unless we have a good industry, it's not going to happen. All sort of industry, not only medical industry, it has to be everywhere, automobile to space-wise. So we have to be everywhere where industry supports us in a manner. I think that is what we are looking for. So what are the objectives for a 2047 vision? We want to have an economy which is $30 trillion economy. Therefore, per capita income will be around 18,000 to 20,000 US dollar. So that is the dream. If you can achieve that, that can only happen if you have world-class infrastructure with us and have a very good governance. In governance, we know that digital economy has to be there, which is coming up very nicely in India. Things are changing very fast, so maybe we can achieve this. At least there should be 3 or 4 global champions. There should be in the top tens, not hundreds. That is what we are looking for. If you look at the last slide, the R&D organizations should be, at least 10 Indian institutions should be amongst 100 globally. That all will be there. Today, if you look into the topmost countries, India is nowhere in that 100 list. If India maybe there are at least 5 or 6 industries are there. The rest are other countries, mainly China. So there has to be absolutely thinking in a manner where we achieve this. Everybody has to work in a unison. Self-reliance in defense and space sector, fostering green growth, I think that's also very important. And most importantly, give power to youth. That is what we are going to take about. So what are these things we are looking for? Which are those fostering India's economic growth? I think growth of middle class is one of the major chunk which is creating a huge difference in our demand and supply. Similarly, we need to have an accelerated digital economy, e-commerce. That is what we are on, and that's going very nice in the country. But important thing is sustainability of this economy. How to sustain this economy and take up to that area which is going to be the challenge. So these are all 7 important areas: middle income trap, aging population, maintaining high GDP, rupee-dollar equilibrium, geopolitics, regional integration, which is again a challenge, and most importantly the lower labor force participation, which India says we can contribute better way. So that is what is. This is the data from World Bank. If you see per capita income, which I talked about, where we want to reach 26,000 US dollars per income. Just now we are at I think 3,176, which is quite not bad. It's quite good. But to achieve this, the 30,000 per capita income US dollar is going to be a big challenge for country. That's why I talked about the industry is one of the important areas. But what about the health sector? What are the important things here? We all know education, health is a fundamental right for everybody. Education, yes. Why not health? Why should we ask for where is the hospital, where are the doctors? It should be reverse. The doctors and health sector should come to our people. Where are you? Have you gone through the vaccination? Have you had this? They should be coming to door. So that thing has to be taken care of. Rather than a sufferer going to a place, it should be reversed. Then only we'll improve. That's why absence of illness, which is going to be very tough, because we are living in the earth, which is not, which may have been there in 1 lakh years before. It's all polluted. It has chemicals. It has carcinogenic things in the environment. Your water is not safe. Your air is not safe. How can you be free of illness? You never know what type of viruses you are facing every day. There are millions of viruses surrounding here. Just now here there will be millions and millions of viruses. Which virus is going to affect you is we don't know. Your immunity has to be very, very strong enough to take care of those challenges our body faces every day, every minute, every second. So that's the important part. So we need to identify those things and see. If I do a culture, we can culture hardly 2% of organisms which are causing infection to the body. 2%. 98% bacteria. How can we detect those 98% of organisms? By doing genomic studies. So it's not culture. Culture requires so many other environmental factors. Things have changed to an area. Specifically, we need to a genomic study for that particular bacteria. But it's a huge cost. To pick up one genome, you have to study billions of genomes. Then only you can pick up. So that type of difficulty we are going to face. Other important area is distribution of the manpower, infrastructure as the population base. That is how we have to plan. The government has to plan in such a manner so that we reach the if I say one doctor is required for a 50,000 population, if you calculate it might happen, but it doesn't happen because there are 100 doctors sitting in one particular can say metropolis area. There is no doctor in a peripheral village area. So this distribution has to be taken care of. And that can only happen if we open the way for a development of those areas by opening industries, by opening schools, by opening various other infrastructures. Access through the road, access through the train, access through the air, then only those peripheral areas will also come up. But things are coming in that way also, which I'll come again. So this is what we are looking for. I think we have young and old population both. Middle-aged population is stagnant. We have a large number of young population and we have a large number of older population, and that's going to increase every year. Like if you know that 1947, the life expectancy of Indians were hardly 37 years. Today it is 72 years. By 2047 maybe 100 years. See that the age group which we are going to sustain is a huge, and you have all the disorder, diseases coming at that age. So we have to look into that area, which will be a huge challenge for us. Similarly, the infant mortality rate was very, very difficult in 1947. I think out of 100 births, there was almost 40% infant mortality rate. Today it is around 1%. So how many young kids infants are living? Premature babies are living. 30 weeks, 32 weeks, 28 weeks, 26 weeks also surviving. And they come with a lot of challenges. They have development issues. They have respiratory problems. They have eye problems, which is called ROP or retinopathy of prematurity. They go blind. So if you have that kid blind person living for the next 100 years, how much is the problem for the family, for the society, for your country? So those areas we have to look into. So that's a real challenge. India is struggling still with the communicable disease. The largest death in India is caused by, any idea? Communicable disease. Tuberculosis. For Western world, it's a gone thing. For us, tuberculosis still is a major killer. I think after the road accident, number 2 is tuberculosis. So that we can't control yet. And we are having various non-communicable disease coming up, which we call lifestyle-related disorders. Diabetes, biggest challenge for all of us. And the youngest lifestyle disease is, for eye-wise, ophthalmic-wise, youngest is the myopia. That's a big challenge for not only for India, for the entire world, especially Asian countries. So you have so many things coming up. So if we are struggling with communicable disease like tuberculosis, mainly because of this, I'll come again later. Then mental health. We think India, everybody is happy. We have joint families taken care of, but India has the largest number of people with a mental health. So that has to be tackled, and we hide those things. We don't come out, and you come to the doctor or a physician or hospital when your things are out of control. In US, even you have a little anxiety, they come rush to the doctor. I have anxiety. So we have anxiety in a day at least 15-20 times. You don't bother. So that has to be looked into for future-wise as a developed country, because this is going to be a major factor again.
We accept it as a part of life.
So that part we have to also look into. Yes, the education has to be there. Education, the basic education has to be there for everybody, but you have to have a linear pillar for our education also. You have to target one area and be one of the best person in that area. So you have to have a people who can, you can say, govern that particular area, be a mentor for the generation of people coming. India has that talent, and they can do it. And we have a lot of high expectation for higher education also. So these are, I think, 9 areas I picked up where we have to work. Infrastructure I talked about. Financing is a major problem, because anything which you want to make sustainable, the finances has to be there. Otherwise you can't sustain them, and that has to be a growth wise. It cannot be stagnant finances. Finances has to have a good growth in that area also. Human resources, India has no dearth. Only thing, you have to pick a right person at right place. Because what happens here, you have a number of people standing outside, but you pick up sometimes not the right person, you pick up the person who is not suitable there because of various reasons. In that way, you lose the right person, and he goes to US or other places, then things are out of your hand. So that also is going to be a challenge for future, especially looking now where every country is trying to block the people coming from outside their country. So that's going to be a challenge for India also. So we have to create the infrastructure for these people to work in our country and do same work which they have done for other countries. Because most of Indians are holding a big position in the world over. Why can't those people in our country? And that is what we have to do for a 2047. Technology adaptation, yes. And we talked about care. Care has to be quality care. If I want to have a paracetamol, it has to be a quality paracetamol. 500 milligrams is 500 milligrams, not 250 or 280 milligrams. So that is important. Therefore, you require a quality checks. That accreditation system has to be there, as strong as FDA, US FDA, maybe bigger, more than that also. Then look after disease burden, which is a major challenge for us. Public health preparedness, which is also we are not prepared for this thing. We talked about dry eye, which is a good area for a future research also. Glaucoma in our field. Very difficult to survey in glaucoma, because to diagnose glaucoma you require so many things. It's not the intraocular pressure only. It's not only the optic nerve disc. It's not only the fields. Everything composite has to be there. So it's a very challenging way forward. I'm pretty sure we have AI-based things, so things will become easier for all those mass-related, surveys and awareness programs. So this is what I talked about, population growth. India is really exploding in that area. Aging population, epidemiology is changing very, very fast because of the population change and the differences happening in our people in our various areas of work. Then diabetes and other things which are the non-communicable disease, which is important. In that, one of the important thing which is the second most cause of largest death with disease is the cancers. The oncology has to be one of the best in the country, because now that's a major challenge for us, and that is the one area where India is lacking. You require medicines which are cost effective for these people. They are very costly treatment. The surgery is very difficult, and the rehabilitation for these people are very difficult. So that part we have to look into, to really look into the increased demand for a healthcare workforce. Today, if I work for 10 hours, it may not be sufficient when you're 2047, unless you have a Dr. Titial hundreds. So that's not going to happen. You have only 2 hands. You can work for 12 hours or 14 hours max. So how to increase that workforce? So you have to have a more manpower in that, and technical manpower to support that areas also. So what should we be doing to improve healthcare structure? In that, new hospital, diagnostic centers, everything is there, mobile health units, and more important, new generation is telemedicine facility. Where I'm sitting here, I can, be with the entire country. Anybody can contact through telemedicine, and I can give my opinions. I can direct that person to this hospital, this place, this person, this treatment, and that is the future. To get connected to everybody. Now today, luckily the network is so well designed in the country, we can get connected to everybody in this country. So that is a very important part which has happened, and that has to make very, very strong, and if possible, that should be AI-based systems, where if I send my picture of eye or a retina, the AI thing tells you, okay, you have to go to doctor, you don't have to worry, come after 6 months. That will decrease the manpower requirement, which will be a challenge for future, technical manpower. Other important thing I thought about is the R&D facilities. That's the major challenge for India. We are not doing the research which is actually going to help the country in a manner which is going to take us through another 40, 50, 100 years. Most of the time we copy what other people are doing. So we are already 10, 15, 20 years later than what they have done in every field. So we have to work in such a manner, we should be the pioneer in those areas. And this is the challenge for all of you are going to face. Look into these directions so that our R&D is done in such a manner where we achieve the universal health coverage. Especially look for areas which is a very robust public and private healthcare sectors. And finance-wise, I think the insurance schemes which government is putting up or a private sector coming up, that's going to be a savior for many of us. Because the treatment is going to be so costly in future, unless you have a good insurance cover, you will be in the road. Because the government sector will not be there. They'll just give you a tea only. If you want to have a coffee, then you have to go somewhere else. You won't have money to pay that. So good insurance coverage schemes has to develop by the government, and that can only happen with various long-term planning by the both government and private sector together. Amongst the areas which I talked about, research, teaching and learning, multi-sectorial collaboration, which is also very important, environmental sustainability, these are all important areas for a future-wise to look into. This is the 6 key area by which we can strengthen our workforce in the healthcare areas. In that, one of the important things is governance, which is either through the government networks or they develop different guidelines, frameworks for various areas of private sectors coming up together with. Workforce and faculty strength has to be increased. Most importantly, if you have a digital universities, because nowadays physical universities are going to be very tough. Because if I want everybody to study in a Delhi university, it's not possible, because they are best in the country. But how do other people attach? Maybe the digital university has to come up with that, and that will increase the wider acceptance of the learning which is going through these universities also. And most importantly, look for always look for emerging technologies. Try to grab that, or create your own areas of specialized fields. Today you are looking for one example. They came out with a silver ion technology, something new. Now people have a different ways to have a preservative-free medications. But some innovative idea will definitely change the concept of dispensing certain drugs, dispensing certain medications, and which is always going to be beneficial to the society. Because we are looking for a quality. Once you have a quality, money is a secondary issue. The problem here, what happens, you have paid so much of money, despite that you are not getting quality. So that challenge we have to kill. So if we achieve that, that's how we are going to do it. So this is the timeline which is from National Health Policy profile. If you see the difference between the manpower demand in millions, you see this is the demand. Today we are here only. So much a difference demand and people there. So this has to come down by 2037 almost equal. And by 2047 we should have more than what people are demanding. That's only you have a Viksit Bharat. तो बोलना बड़ा इजी है विकसित भारत बट उसको वहाँ तक पहुँचाना बहुत टफ है. So the road map is very, very tough, and I'm not sure everybody has to be there. If you look into this, a government way to look into doctor, dental surgeon, Ayurveda, everything has to be together to get into that area also. Technology is going to take us there. Only technology. In that, artificial intelligence, machine learning, blockchain, healthcare systems, use of drones. This is what we are trying in various remote areas. I think one of my dream project was to distribute the donor tissue. The people donate eyes to transport them to different areas, and we wanted to connect all these areas which are attached to AIIMS New Delhi. So it's going on, and it might be successful. But if you see other areas like Rishikesh AIIMS, they connect to all hill areas. They can send the medication through drone. They can get blood samples from a drone. In future, they can have organs going through the drones. You don't have to make a green corridor for that. It will go by air to air, and if you take a half an hour with a road, it will take 3 minutes. So that's the difference we have to face, and that area we have to look into. Unfortunately, drones have gone through so much of disrepute in terms of using them for public way. Defense areas are looking in those areas. People are fighting through drones only. So getting a good license, good you can say the air space is going to be tough for us. So that's also a challenge. How to take care of that area, we have to look into that also. Digital transformation, you all know that telemedicine is going to be important, and electronic health record keeping, that's going to change the country. And it's happening thankfully in all new institutions, but older institutions, government setups are still struggling in that area. And other important is the health information exchange, which is going to happen through the learnings and the various surveys to know what is the extent of a disease, disorder happening in one community or those areas also. So this is what I was talking, genomic data. Country needs the genomic data of everybody. If you are born today, your genomic data should be there in the bank. So tomorrow you won't have a difficulty, because we can target each genomic area to treat through the gene therapy also. And gene therapy will only be a future when you have a data of all the, not Aadhaar card. It has to be your genomes attached to areas. So that is what is going to happen. If you pass through some areas, you have to have your genomic attached there, otherwise you won't get access. So this is going to help you in other things also, to take away the genetic disorders, the hereditary disorders. So people will know beforehand by clicking, okay, राजकुमार का रिश्ता आ गया राजकुमारी के लिए, इसके अंदर you know, oh, the Rajkumar is suffering from a retinitis pigmentosa gene. So you're not going to make, because it's difficult to ask today. It's so look so embarrassing to ask, are you suffering from retinitis pigmentosa? difficult. But this is how it's going to save the country and save the people, so that this disorder will go slowly, slowly in the background. Once you have a perfection. Today, if you get, pregnant, within the first 3 months, you have to get through all these studies now, compulsory. So that if something is not healthy in a baby's womb, that can be taken out, rather than having a baby born with so many genetic problems. So those things has to be done in a beforehand also. I think this is what the last few slides, that the mental health education, lifestyle interventions, nutrition, exercise. This is a common thing for today. But I realize nutrition we don't give a real importance. If I do today a B12 parameter for people, I think there are 67 people here. I think 57 will have less B12 in their blood. Same for a vitamin D. So those are very important for your immunity, to resist the attack coming from that area. To get through those profiles also every day. Today we are trying to treat dry eye with the vitamin D profiles, because vitamin D is one of the important things which can cause all those neuronal pains. And dry eye is immune related disorders also, because inflammation is an important part in dry eye. Once you have inflammation, it damages the nerve fiber ends, nerve plexus, and vitamin D can save that also. So every vitamin has its important role in these areas also. AI is, yes, definitely has to be future. It is going to give you a lot of access. One thing we have to learn is how to decrease the unwanted effects of AI. So that has to be looked into. So that I think people have to work in those areas also, and try to. I think this one important thing, cyber security is going to be a challenge for all of you. This came up because we had the cyber attack in AIMS data network multiple times.
In names also?
Yes, and it was a big news, and many people got suspended also. So that can happen to entire country. Digitalization of everything. So cyber security is going to be the future attack country. Digitalization of everything. So cyber security is going to be the future challenge for you, and every minutes people are trying to do some difference. They have a wider network. They have a more important people looking after those areas, more effective, more efficient, and also their network is bigger. So I think if you have a good combination of public sector, private sector, things going to make a huge difference. Similarly, inter-government, country relationship, collaborations, going to make a easy access for developing new things, and that is how you are going to achieve. Suppose today people have developed something research in Mars. So we know that this research has happened. If you have that access, you can do something new. So that collaboration is going to be the future for India to get into a developed country. So you need to have work in the defense forces area, IITs, IIMs, private technology partners, international universities, and public sector units. All these areas are very important for us, and that is how the health sector will also come up. I think India would be the hub for a medical tourism. It's all together. Your industries, the infrastructure, the private sector is the one which is going to attract the medical health tourism. Tourism is good in a way. It's not only giving treatment to those people, it also improves your country's image in terms of better health facilities, also earns the revenue for country also. The road ahead is very tough. So if you start from one corner, you might end into the same corner, unless you expand that corner in such a manner. So if you start with the infrastructure workforce, then look for a public-private partnership, ethical regulation of those private areas, use intelligence, from the artificial intelligence, approach in a better way, precision medicine, promoting medical tourism, and ultimately a digitalization of a healthcare system. All these things are going to take you through in this 22 years journey coming up next. So if some people are very young here, they still be working in 2047. So huge responsibility to us. People are working in our industry, people are working in our private sector, people are working in our education areas, people are actually who are governing the system. They all have a huge responsibility to take us through the good days. जो हमारे सपने पूरे हो सकेंगे नहीं हो सकेंगे by 2047. Think it, and it might happen. Thank you for listening.
Thank you, sir, for your encouraging words and this vision 2047. Now, I would like to request Pratik sir to please welcome Dr. Yash, who is an educator from the Asian Book of Records. Now, may I request Dr. Yash to please say a few words.
Jai Hind, good evening, namaskar. Let me try one more time. Jai Hind. Jai Hind. Now it sounds energetic. So, very warm welcome to all dignitaries, my batchmates. Padam Shri Dr. J.S. Tatiyalji, you're most welcome. Thank you for coming. And all mankind dignitaries and management. So, today we are here for achieving the record, maximum ophthalmologist digital pledged for dry eyes awareness at Mankind Pharma, Delhi. I think establishing this record is a clear message that we are just not establishing a record. हमने कोई कागजी टुकड़े पे नहीं लिखा है कि हमने record establish किया है. We are creating a history which will educate the other people and will learn more. We can hashtag it with with ACP, awareness matter, comfort matter, and patient matter, and we'll forward it. So let's together blink more, care more, and ensure dry eyes no more. So thank you so much, sir. So although I'm very young in age, but thank you for giving me opportunity to come and facilitate for this. Thank you so much. Thank you very much. Certificate कौन receive करेगा?
Everyone, Sachin, Rahul, please. All sales and medical. Rajkumar, please come.
I think team needs to be first. Come, I want you to take it. So I think such should have this. Supriya should take this. Yes.
So it is a wonderful moment for all the Mankindians. Now may I request Mr. Pratik Dubey, our CHRO, to kindly come over here and give our note of thanks. Over to you, sir.
Before I say anything, let's congratulate the winner. Let's congratulate the winner. Round of applause. Thank you, everyone. I would love to say a few words in Hindi for sir. Sir, देवभूमि के देव आपका नमन करते हैं, अभिनंदन करते हैं, अभिवादन करते हैं और मैनकाइंड प्रांगण में आपकी उपस्थिति के लिए धन्यवाद करता है। Dr. Yash, words will be less to say thanks because you may look young and handsome like me, but you are marking your presence and that is creating a good image for us, right? So, 2-3 things. One, Dr. Your words were not only information, and I assure you, being a HR head of the organization, that this has sown a seed of wisdom for us to make a Viksit Bharat. Swasth, the patients whom you have taken care, the family of those patients, I think we all should say thanks to him for that, right? So more than 5,000 people are seeing this as of now live. And believe me, sir, all 5,000 people are admiring your work. And we would all say, पद्म से जो सम्मानित हैं, उनको हम पद्म दे के थैंक्स बोलते हैं. Gentlemen, before I say anything, I want you all to give one commitment in front of the CEO of our organization, Mr. Sheetal Arora, in front of the doctor, in front of Yash, Dr. Yash. We all will donate our eyes. Who have not done it, can we commit loudly, people on screen, off screen, all? Can we do this? Yes. Let's do it and we commit in front of you. This is the way we want to thank you, Doctor. This is the way we want to thank Yash, Dr. Yash. Thank you very much. Thank you everyone on the screen and off the screen. Thank you.
I just want to add one thing. First of all, thank you so much, sir, for your enlightenment of what is the Viksit Bharat is going to look like in 2047. But most important thing is that 2047, if we have to achieve 30 trillion economy, then people should keep on working for a longer number of years and a longer number of per hour in a day. For that, we all have to be healthy. It will not get recorded. Healthy and being in a healthcare sector. So it's our responsibility to contribute in the development of the nation when nation would be 2030, when the nation would be 30 trillion economy in next 21 years, like Dr. Saab has enlightened us. So we should commit to ourselves that not only we should keep on working for long number of years, we are in healthcare sector, healthcare profession, so that we have a huge responsibility on our shoulder that nation should remain younger, healthier, and should live for next, at least that right now that age is 72 years, so it should be more than 100 years for that. Then only we will become developed economy. Thank you so much. Thank you.
Thank you, Sheetal sir. Thank you everyone. Thanks to everyone in the room. Again, let's be healthy and happy. Yeah, you would like to say something.
I'll be taking the mic because it's recording. Thank you so much, sir. It's all getting recorded. Now, just as the kite soars higher when carrying them far and wide, I invite our esteemed guests and all the participants to pen their messages on the kites which are placed outside. You must have seen it out there. So must do that, because these kites actually symbolize the commitment to this collective journey towards better eye health and brighter vision. Thank you once again and have a wonderful evening ahead. Thank you, everyone.